Hi everybody, this is Dr. Paul Theriault, and I've decided to make a video about, what is naturopathic medicine. I find myself explaining this to patients and to, people on the street and to friends and acquaintances and, business partners and, almost everybody quite frequently. So I decided to codify my thoughts on this matter and make a video out of it so everyone can have them. So I hope you'll enjoy it. Let's get started. So what is naturopathic medicine? Naturopathic medicine is a complete system of primary care, addressing all the areas of medical need. We do cardiovascular care, we do hormonal health, both for men and for women, and for both at the same time. We do metabolic diseases like diabetes, digestive health, mental and emotional health, which I am particularly specialized in, immunology, and almost every aspect we do. In terms of what diseases we treat, almost everything. Diabetes, mental health, autoimmune diseases, Alzheimer's, hormones, stress, cancer. Really, if you've got a disease, it's likely something that a naturopathic doctor can do something about it. As a matter of fact, generally we treat so much that it's usually quite a bit easier to explain what we don't treat. So, naturopathic doctors generally don't do emergency care. We absolutely are qualified to do emergency care when it emerges in our clinics. For instance, I'm certified in I've got my CPR certification. I've got my emergency procedures certification, so I can manage any emergency conditions that emerge during the course of the treatment I give people. But emergency care in the sense of people who are dying of pneumonia, or people who are on death's door from acute infectious diseases, or people who have had limbs chopped off through an accident or something of that nature. That generally we refer to emergency care. They do a very good job there. We also do work constructively with other medical practitioners. For instance, people have often asked me, can I see my medical doctor, my family physician, at the same time as I see you? Yes, absolutely. Every ND that I know will work cooperatively with medical doctors and will co-manage care with them. So you don't need to exclusively see a naturopathic doctor in order to benefit from our services. So, having said that, what makes naturopathic medicine different than regular medicine? Naturopathic medicine stems from a very different conception of health and illness, and we use very different treatment methods, and we're going to go into that in greater detail right now. So, the basic system that needs to be, or the basic problem that needs to be really looked at in any medical system is, what is health? What is disease? And of course, the great question that medicine has to do with, how do we deal with these things? Naturopathic doctors have a very different definition of health and disease than conventional doctors do, generally. Health is viewed as a spectrum, not as a particular thing. Health is a spectrum, and disease itself is also a spectrum. Health and disease exist on the same spectrum of function. So, at one end of this spectrum is health, the other is disease. You've got a picture coming up next, and that should really help explaining this. So, this diagram shows a bell curve, and on one end, the left end, we've got health. On the right end, we've got disease. The spectrum here represents the function of we can say an organ or a tissue or the person as a whole. So the further left you get, the more function you have. The further right you get, the less function you have. So we can see from this that some people have a very good view of health. They have got their function is very, very high. Their organs are working great. They're breathing well. They're happy. They're healthy. Everything's working wonderfully. Their tissues are functioning well. On the other side, on the right side of this graph, we've got people who've got very poor function. Nothing really is working terribly well. Their organs aren't performing the way that they should, and they generally probably feel quite bad. In between the two, you've got a number of people, and this is where most people are in day-to-day life. You've got most people who are kind of in the middle of them, or between the two. Their organs don't function perfectly, but they're doing okay. Naturopathic medicine sees health and disease this way. Disease isn't a thing. It's a process. It's a state of function of the body. Naturopathic medicine, with this view, focuses on restoring health. It focuses on increasing that functionality. When we increase the functionality, the disease that is the result of, things not working well goes away. It's really a very different perspective. Allopathic medicine tends to focus as disease as a thing, as an event that happens to people, and they treat that disease, and then once the disease is gone, they assume that people are healthy again. We don't see things quite that way. We focus on restoring people to health, and then when people are healthy, disease goes. So it's a small difference, but it's quite an important one. So that begs the question, how do we get people to health? Naturopathic medicine was really very well served by two clinicians, Pamela Snyder and Jared Zeff, who quite a while ago, I believe it was in the 90s, laid out the healing process and defined it very succinctly in 6 steps. So we're going to go into, and those steps are creating the environment for health, stimulating the vitality, tonifying damaged organs, addressing structural integrity, addressing pathology, and the use of surgery and drugs. So we'll go into each of these in a little bit more detail. So creating the environment for health. Basically, the viewpoint behind this states that humans need a certain environment in order to be healthy. We have needs for food, we have needs for chemicals to either be or to not be in our environment. We have needs for water and shelter and clean air and a social environment. This step of healing is when I, or whoever your naturopathic doctor is, will go and take a very thorough history and determine what it is in your environment that is not supportive of health. And how do we adjust that? It can include removing things that disrupt health, such as toxic exposures, poor social environment, or other things, or instituting healthier regimes. Things like routine, structure in a life, diet, spiritual, like your spiritual ideas and spiritual practices and things like that. Relaxation, recreation. How many people have I prescribed that they need to turn their cell phone off at the end of the night and just have a nice relaxing evening? I also consider the environment for health being involved with diet. Sometimes our diets just aren't supportive of good health. Sometimes our diets just aren't. Our digestive system isn't capable of absorbing nutrition right now, and we need to supplement that with either intravenous nutrients or with just a multivitamin or something of that nature. And elimination. This is ensuring that our body is capable of disposing waste. The second step, and the step that I'm most fond of, is stimulating the vitality. The body has a very beautiful ability to correct itself, to bring itself back into a balanced state. But sometimes when it is unhealthy for a very long while, it stays in that unhealthy state, even when the environment for health, or the environment that it requires in order to be healthy has been removed, or has been the environment it needs to be healthy has been restored. Therapies like acupuncture, homeopathy, and hydrotherapy are how we do this. They just give the body a little bit of a push to restore itself to health. Some newer therapies as well, such as mistletoe injections, also do this, and it's one of the reasons why I'm so fascinated by that branch. The third step of healing is to tonify weakened organs. Sometimes, after you stimulate the vital force, which we did in the last step, a few organs can lag behind. Some organs just aren't healing as fast as others, and they start to, hold back the person's healing progress. I often find this. For instance, we might help somebody's diet work out. We might help somebody find a better diet and find a better regime. Might give them a homeopathic remedy, and their complaints get 90% better. Except maybe their skin is still gets a rash when they're stressed out, or they still feel a bit tired, or more so than they should. When that happens, quite often we'll use either specific homeopathics, acupuncture, herbs to just specifically give those organs a little bit more of a push to re-regulate themselves and to heal themselves. The next step is correcting structural integrity. When the organism functions in a better way, structural therapies are far more effective. For instance, I work with a number of chiropractors and massage therapists. one of the most common reasons they refer people to me is when their physical therapies aren't working. So, you're getting adjustments, but, the patient is not, they've plateaued, they're not getting any better. They're not holding their massages, their muscles continually cramp up, and so forth. So when people get healthy internally, when they do those first 3 steps, the structure tends to be able to resolve itself. I often refer for this just because, I work with so many chiropractors and massage therapists, but this is just truly an excellent area of healing, well within the scope of naturopathic medicine. Next, once you've done those 3 things, there are times when the body's self-healing abilities have been exhausted, where the body cannot fully recover from something. So at that point, you need to address that. You need to occasionally deal directly with pathology, sometimes to prevent damage and sometimes to preserve life and limbs. You can use supplements or drugs to do this, or you can use surgery or pharmaceutical suppression. For instance, when somebody has a kidney failure and they need a kidney transplant, you need to suppress the immune system, or they're not going to do that well. So when you've done the first 4 steps, creating the environment for health, stimulating the vital force, tonifying any weakened organs, and addressing structural integrity, you don't need to do the drugs and the surgery nearly as much. It does occasionally happen, so we include that within the ideas of naturopathic medicine to acknowledge that that there are times when it needs to happen. We very often refer for that, so that's part of where our cooperative relationship with other medical professionals comes from. This part is quite interesting. I propose a new step in the healing process. I would probably put it in after the addressing the structural integrity, but I think a great deal of the promise of naturopathic medicine comes in its ability to support the patient in their own process of development and growth. Humans, when they're healthy, inherently grow and develop. We become better people. We learn. We expand our horizons. Naturopathic medicine is uniquely capable of supporting people through this. So this topic is a little bit bigger than this video than I can discuss in this video. I will be doing another video on this topic, specifically on the use of homeopathy to support this. So, as I said before, we compare and contrast this model with the allopathic therapeutic model. So allopathic is a word usually describing the therapeutic ideas of conventional medicine. So, most MDs are trained in this. So I use the term allopathic just because I find it a little bit more anthropologically descriptive than conventional. So their basic treatment model is the diagnosis of treatment of disease. The focus is on disease, not on health, and so forth. So I hope that's a pretty clear contrast right now. So now for the interesting part. How do naturopathic doctors actually get people back to health? We have a number of therapeutic modalities that we do, and this isn't even an extensive list. Naturopathic doctors we have a very wide scope of practice. We can do almost anything for therapeutic effect. So let's go and begin this. Nutrition is the foundation of almost every naturopathic doctor's practice. As such, there's very divergent opinions on it. There are very many schools of thought. I have my own. I tend to favor the Weston Pricean school of nutrition just because it tends to focus on some very good data. Weston Price was a dentist who about a century ago came and described the health of a number of native peoples who lived, routinely over 100 and who had excellent teeth and everything, and he looked at their diets and he synthesized this. So I favor that just because, when you see a group of people that's been eating the same thing for hundreds of years and this is how their health is, quite well, this is the effect the diet has on the human health. My approach usually includes both dietary changes and sometimes supplements. And nutrition, we use this both to promote health and to deal with pathology and so forth. So it's a very widely ranging therapy at most stages of the therapeutic process. Acupuncture is another modality. Not every naturopathic doctor does this, but most in Canada do. You're using needles and you insert them directly, or sometimes you simply use pressure, like with acupressure, to alter the body's function. This can be done on the ear or on the body, and you can use either needles or seeds on the ear. We use this to deal with chronic disease, for structural realignment, and to deal with chronic issues that stop the body from healing, as I described before, to stimulate the vitality to re-regulate itself. Homeopathy. Homeopathy is a very interesting school of medicine that uses remedies to unlock the body from patterns of stuckness and help people get free of either where their body is stuck, where they're not healing, and of their psychological blocks. Homeopathy is the therapeutic system I use the most in my work with patients, helping them grow psychologically. When you give somebody a homeopathic remedy and they respond to it, their disease improves, toxins get released much more quickly, and personal growth occurs a great deal. Now, homeopathy is a very controversial system, but it does work. In my own experience, it does work, and it has an increasingly sophisticated research backing. I wrote a blog on this, so you can see this is on my old blog. It's drpaultheriault.com/research issues in homeopathy, and you should get a good overview of the research in homeopathy, the kind of research issues, and the emerging research consensus with homeopathic medicines. It's a bit older. I wrote it in 2012, and I think I may need to update it soon, but I haven't done that yet. So if you go to my new blog, which is drpaultheriault.wordpress.com, you should be able to, when it emerges, you'll be able to see it. Herbal medicine, another favorite of mine. You can use it to alter biochemistry in a way very similar to a pharmaceutical. You can use it to promote function and to balance physiology. You can also use it to help the body, again, stimulate the body's vitality, to promote the body to excrete toxicity. And you can also use it to directly address pathology when you need to do that. Rauwolfia is a herbal medicine that we don't have access to in Alberta right now, but I think it's hopefully going to come soon. And it is one of the very few things for to use with people when they have chronically high blood pressure that's non-responsive to medications. Works quite well that way. So, herbal medicine has a very wide spectrum of activity as well. This is one that I think most patients have a fair degree of familiarity with. This is drainage and detoxification. This is basically a number of methods to remove toxicity from the body. Toxicity is an interesting concept. It tends to be not a popular one because it's a very general concept, but toxins themselves are very general. They can be internally generated, they can be externally generated, they can be hormonal, they can be metabolic, they can be xenoestrogenic, or simply like completely exotic to the body, or heavy metals, or I did a heavy metals challenge test on one person one time, and they came back with a ton of plutonium in them. That's an incredibly foreign component. So, in general, commercial and popularly available detoxes tend not to go deep enough into people. And many people are so sick that they simply cannot detoxify effectively. Drainage therapy, what I do with people, is very personalized, and it does take a while. It does take, months and months and months to really thoroughly remove the toxins from people. It's not something you can really do by eating brown rice and, taking a few pills for a few weeks. But this process is quite gentle, so it's not, very intense, and so people generally can keep up with the program for several months. And drainage is far more suitable for very frail people. It's one of my mainstays. Most people get a little bit of drainage from now and again. A new development in naturopathic medicine is intravenous and injection therapies. This is basically using, conventional, we use the same safety procedures and the same tools that other health professions use to deliver nutrients in very large amounts directly into the circulation. This way we're bypassing the digestion, which in many people is quite compromised. I had one patient who had all but 5 feet of her small intestine removed. I could have given that lady nothing but supplements, and she wouldn't have absorbed enough of it, or enough of them to really make a difference in her health. I referred her for some IV therapy to a good friend of mine who does that, and she improved dramatically. just getting those nutrients past the digestive system really shifted her health problems. This is a very interesting therapy. I probably am going to be seeking certification in it in 2015, so I hope to be able to offer it to my patients as well, but for now I refer. And so forth. We also do intravenous and injection of herbs for specific purposes, just depending on the therapeutic indications that we need. So I find this a very interesting addition to old school nature cure. It's a way around digestion when digestion is an issue. So I think this fits in perfectly with older naturopathic traditions, and I'm very interested in it. It's becoming more and more widely used, and our knowledge of its potential applications is increasing, so stay tuned about this one. Counseling is, I think, the foundation of almost every naturopathic doctor's therapeutic approach as well. Counseling ranges on issues of everyday life, like how do I cope with school? How do I cope with my career? What am I going to do with my boyfriend or girlfriend or what have you, to more psychotherapeutic approaches. My personal choices, I do a combination of near psychotherapeutic approach and of just questioning, like, what do you want? What's going on in your life? How is this affecting you? And so forth. And I usually combine that with homeopathy, and I find that incredibly effective. It's really gratifying, actually, to see how patients grow under this method. This is why I do this job. It's just beautiful. So, right now, NDs are professionally regulated in 5 provinces in Canada. We were recently regulated in Alberta in 2012. All naturopathic doctors have undergraduate degrees and professional doctorates, so we have about 8 years of education behind us. So it's a very rigorous profession to get into. We also have 2 licensing exams that it's called NCLEX, so Naturopathic Physicians Licensing Examination, and we have one in 2nd year and we have one in 4th year, and you need to pass those as well as provincial board exams in order to to practice as a naturopathic doctor. So I've done all that. Most people listed on the website of the College of Naturopathic, all people listed on the website of the College of the Naturopathic Doctors of Alberta have fulfilled these requirements as well. So our education and our licensure is really quite rigorous. There are additional certifications one needs in order to practice advanced modalities. There's certifications for prolotherapy, for IV therapy, for acupuncture, which I have, and for minor surgery. So our education is quite rigorous. So that's pretty much all about naturopathic medicine. If you have any additional questions or you'd like to have a free 15-minute consult with me, please do give me a call, or please do give me an email at drpaultheriault@gmail.com. You can follow me on Twitter at drpaulnd. My website is drpaultheriault.com. I have a new blog press site, and if you would like to book in for an appointment, my telephone number is 1-855-225-5692, and I hope to hear from all of you, and I would really like your comments and questions and everything else as part of this video. So otherwise, I hope you all are doing great. Take care of yourself, and we'll talk soon. Bye!